This video will demonstrate the documentation of vital signs for a paediatric patient. Within the interactive view, the nurse will select paediatric vital signs. You will notice that some of the vitals are colour-coded and they have arrows assigned to them. These are not based on acute parameters, however, and offer a guide on single parameters that may be out of range. E-range parameters are inline. From the observation machine, directly enter the observations into the appropriate cells. Observations are never to be written on paper and then transcribed. Double-click the top bar. This will allow you to tap through each cell, which is faster than clicking each cell individually. Enter the resp rate and enter resp distress. Enter oxygen saturations. Enter oxygen flow rate. This always needs to be entered to calculate a score even if the patient is not on oxygen. Enter oxygen therapy. This is not required to calculate a score. Blood pressure does not need to be taken with each set of observations to obtain a score. The blood pressure mean automatically calculates. Enter the peripheral pulse rate. Temperature is taken as required. If temperature is not assessed, this is to be documented in the temperature not assessed cell so that a score continues to be calculated. Enter capillary refill. Enter AVPU. AVPU not assessed can be used in situations where a patient is clinically well and sleeping. When using this cell, a comment must be included. This will then allow a score to calculate. Click the green tick to verify. Then click refresh to show the acute score. No alerts have appeared. Now let's navigate to the Managing Deterioration page to view the graphical trending of observations with each set of vitals. The time frame can be adjusted. The usual default is 24 hours. The flyout function will allow you to see all vitals on one page rather than needing to scroll. This page can be printed by selecting the print button. The alert summary will show alert history. The date can be scrolled to view previous observations. The additional criteria icon will display all acute scoring responses according to the patient's age. The altered calling criteria and variation frequency icon is where alterations in calling criteria are able to be documented by medical officers in line with local procedure. Variations in the frequency of observations can also be made here. When signed off, these will appear in the patient's chart as a note. The history of alterations will appear at the bottom. Adjustments to vital sign frequency must be verbally communicated to the nurse so that existing vital sign orders can be modified. Otherwise, the medical officer can change the order directly from the orders page. Your patient is deteriorating. After attending to the immediate needs of the patient, navigate back to Interactive View to enter a new set of vital signs for your patient. In this demonstration, we're entering observations that will trigger a MET call. A MET call alert will appear. This will contain the local emergency phone number for your facility and actions required to be taken. In a medical emergency situation, observations will be documented on the paper resuscitation documentation form. After the MET, you view the Managing Deterioration page to look for trends in the previous vitals. On the Managing Deterioration page, there are yellow and red alerts that may appear. These alerts suggest observations are outside of the normal range. When these alerts appear, check your patient, acknowledge the alert, and follow your acute alerts and actions. Another set of observations have now been taken. Navigate back to Interactive View to enter them. An alert will appear that describes the action to be taken for the score. If you close this prior to following the actions, navigate back to the Managing Deterioration page where you can access the full list of actions according to all CUTE scores. Now we'll enter a set of vitals without all of the parameters required. A message will appear that the CUTE score cannot be calculated since not all required events were resulted. We will now enter another set of vital signs, but this time we will enter 2 temperatures. You will receive an alert to say that you have entered 2 parameters of the same concept. An early warning score will not be generated. Please re-enter the data using only one data parameter to generate an early warning score. When cancelling the alert, you will see dual entry where the score normally sits. You will need to re-enter all observations with a single temperature to generate a score. If you generate one parameter that normally falls in the E section of the CUTE, the MET-call message will appear. Enter 50/22 in blood pressure. Call a MET and attend to your patient. When you return to Interactive View and refresh, you will notice an E where the score normally sits. This concludes our video demonstration for direct entry of pediatric vitals into the IEMR. Remember, always call for help if you're concerned. Please contact your educators if further information is required.